Hi, it's Tom again. I'm here to tell you about health and safety. We'll be looking at what to do in an emergency and if there is a fire. You can find more information about health and safety in the Volunteer Handbook. To begin with, if you ever feel that you are in immediate danger or spot any security concerns, you can call security on the numbers shown on the screen. Your security and safety are our primary concern. So, if in doubt, report it. We're here to help. If you need to talk about any issues or raise concerns, please come and speak to us. Our door is always open. Please don't be offended if we can't see you straight away because we are busy. We will make contact with you as soon as possible. After placement into a volunteer role, please take note of the department's fire exits, fire alarm points, firefighting equipment, and the fire assembly points. Departmental staff will let you know about the local fire safety arrangements. Also, familiarize yourself with your department's fire action routines. Each department will have different priorities and procedures in the event of a fire. If you see a fire, remain calm and act quickly. Set off the fire alarm. If it's a small fire, you might be able to put it out, but don't put yourself in danger. Small fires can quickly escalate. Make sure you have an escape route. Evacuate yourself and those in immediate danger and leave the area, closing any doors and windows as you leave to stop the fire spreading. Make your way out of the hospital and gather at a fire assembly point situated around the hospital and easily identifiable by large green signs. If there are no immediate fire assembly points, then stand away from the building. Fire alarm tests are performed every Wednesday. If you hear an alarming lasting longer than 15 seconds, this is not a test, and you should evacuate the premises. Fire evacuations of non-clinical areas are performed annually, but not in clinical areas due to patient safety. Remember, your priority should be your own safety. Do not put yourself in any unnecessary danger. There are many ways a fire can start. Arson. Call security if you see anybody acting suspiciously around the building. Smoking is not allowed on the Trust's premises, in Trust vehicles or whilst wearing uniforms. If you see any poor wiring, equipment that looks unsafe or poorly maintained, let the manager of your department know. If you see a fire risk due to bad housekeeping, then contact housekeeping for linen, waste collection on the number shown on the screen. For example, if you see piles of flammable materials not housed properly. Ensure at work you don't rush. Pay attention on stairs, wear appropriate footwear. Deal with spillages immediately or inform a trained professional of spillages of dangerous or hazardous liquids. Remember, any problems you encounter must be reported as soon as possible. There are color-coded signs throughout the hospital. Red signs indicate areas where certain actions are prohibited, for example a no smoking zone or an area where liquids are not allowed. Yellow signs warn of potential dangers. Green signs are used to indicate safety routes and gathering points. Blue signs are mandatory instructions which you must follow, for instance indicating that you must keep a door closed. You can find a safety policy in the volunteer's office, which is a requirement of the Health and Safety Act 1974.